Hello and welcome to Health 247 on Rapid Television, your trusted window into wellness, healthy living and life-changing medical insights. I am Josephine Bitrus. Today we bring you expert guidance, key findings and practical solutions designed to help you make healthier choices every day. Let's get started. Micronutrient deficiencies remain a major public health challenge globally, affecting billions of people. In Nigeria, the burden remains particularly high among pregnant women, with serious implications for maternal and child health. The World Health Organization (WHO) is now urging countries transitioning from iron and folic acid supplementation to multiple micronutrient supplementation (MMS) to generate strong implementation research. This, the World Health Organization says, will help access, feasibility, acceptability, equity, and long-term sustainability of the transition. At a recent implementation research validation meeting in Abuja, nutrition experts called for the integration of MMS into routine health services, describing it as critical to expanding access and securing sustainable public funding. Health 247 brings you highlights from the meeting alongside reflections on MMS scale-up based on intervention research conducted in Bauchi State. Micronutrient deficiencies persist as one of the most pervasive forms of malnutrition, with global estimates suggesting that between 2 and 5 billion people are affected. Nigeria continues to grapple with micronutrient deficiencies, a pressing public health issue that persists across the country. The World Health Organization (WHO) is urging countries transitioning from iron and folic acid to multiple micronutrient supplementation (MMS) to generate implementation research evidence to assess feasibility, acceptability, equity, and sustainability of the transition. Adherence is key, ensuring pregnant women receive the consistently consumed and recommended supplements, that is, 1 tablet per day throughout pregnancy. The Federal Ministry of Health and Social Welfare requested implementation evidence to understand introducing MMS in Nigeria and identify strategies to improve adherence based on Maternal and Newborn Death Control Guidelines 2021. Nutrition International, with funding from Gates Foundation, implemented the 3-year project Optimizing Adherence for Maternal Multiple Micronutrient Supplementation (MMS) in Nigeria. The project aimed to generate evidence to guide Nigeria's introduction of MMS within government-led antenatal care platforms. Nutrition International, with Federal Ministry of Health and Social Welfare, National Primary Healthcare Development Agency, and the Bauchi State Government, piloted MMS implementation in 84 public health facilities in Bauchi State. Using human-centered design and co-creation approaches, the project tested strategies to improve adherence and strengthen maternal nutrition programming. Findings provided key evidence to guide national decision-making on MMS integration and scale-up.
The insights generated from this research offers practical, scalable solutions that can respond directly to the realities of Nigerian health systems. They provide solutions to long-standing implementation challenges, such as adherence to antenatal care, and offers an opportunity to guide decision-making and ultimately a path to scale up of MMS. We know that policy makers play a central role in keeping the health and nutrition of mothers and babies high on the national development agenda. Government validation of these findings will play a decisive role in shaping Nigeria's pathway to MMS adoption and scale-up, ensuring programs are evidence-based, context-appropriate, and strategic, inform national roadmap, and positioned for sustainable national scale-up. Your presence and support are invaluable in our collective efforts to ensure the well-being of mothers and their children.
We're really, really happy that Bochi was selected at the first instance. And let me say something. MMS, we are using folic acid specialist. MMS has become a drug that it makes the mother very beautiful, very healthy. We have seen it in most of the mother that the father is the husband that want to take the drug. I say, I'm in trouble, wallahi. They want to take it, they want to collect it from the mothers. I say, it's not for the mother who is not pregnant, it's not for the father who is there. They want to take it because most of the people that are taking it, they look very healthy and more beautiful. I'm also thinking about, let me inform you that we also have an MOU with Get Foundation. For 10 years, MOU, Dangote, UNICEF, and USAID. USAID left. So, the country director, let me inform you, you are not the only one being funded by Get Foundation. We are also in the same basket. So, we want the renewal of the MOU. Even with your own, we don't want you to go. Please continue to remain in Bauchi and as we expand.
A two-day validation meeting in Abuja brought together stakeholders to share findings from the 3-year MMS implementation research project in Bauchi State. The validation meeting was aimed at, to, among other things, review and validate insights to support national strategies for MMS scale-up and agree on next steps and formally close out the project. Director and Head of Nutrition Department at the Federal Ministry of Health and Social Welfare, Mrs. Ladidi Bako Ayebusi, stressed that intensified research is essential to create a robust evidence base for long-term studies and clinical evaluations of mothers and children.
We have been following, working together, and we are excited that the findings, which we will be discussing today, has pointed to the fact that MMS for pregnancy care in Nigeria has come to stay. I thought I would hear a clap for that. Distinguished ladies and gentlemen, kindly recall that this journey did not just start with us getting up and saying we want to do implementation research. As far back as 2020, the World Health Organization updated its recommendations to include the use of multiple micronutrient supplements in low and middle income countries, particularly within the context of rigorous research. Governments cannot do it alone. There are so many researches being carried out in other countries, but we need to localize it. We need to have our own research, our own evidence. And we want to say a big thank you that Nutrition International stepped forward when we made this request. In 2021, to ensure that we have policy backing, the Federal Ministry of Health and Social Welfare incorporated the use of multiple micronutrient supplements into the National Guideline for Prevention and Control of Micronutrient Deficiency. that ensured that everything we're doing had policy backing. And we didn't just stop there. In 2024, multiple micronutrient supplement was officially enlisted into the National Essential Medicine List. This was to ensure that we create an enabling environment for local production. And as we speak, about 4 local manufacturers are at various stages of preparedness, of being qualified to produce locally. Right now, we are importing multiple micronutrient supplements. Last year, we got about 3.6 million bottles. 3 million came from the UNICEF Child Nutrition Fund through Cake Humanitarian. About 600,000 bottles was donated by Vitamin Angels. And all these 3.6 million bottles we distributed to the 36 states and the Federal Capital Territory, in line with 32% coverage of pregnant women. This year, 2025, we received another consignment of 3 million bottles of MMS. However, the distribution is not the same. We used the consumption pattern of what we distributed in 2025, in 2024, to guide the distribution for 2025. However, as we speak, there is no state in Nigeria, including Federal Capital Territory, that does not have multiple micronutrient supplements. Last year, based on the statistics that we have, over 2.3 million pregnant women were given a bottle of multiple micronutrient supplements each. For this year, we are still working on the figures, but we believe it will not be less. Multiple micronutrient supplement is also captured in the current antenatal care guideline. All our guidelines, we have reflected the use of multiple micronutrient supplements. Last year, the coordinating minister for health and social welfare inaugurated a task force to guide the nutrition department of the Federal Ministry of Health on every activity that we're doing regarding the scale-up and the rollout of multiple micronutrient supplements. The task force, together with stakeholders, were able to develop the national MMS roadmap, the first in the world. We were also able to develop the training manual. We have the facilitator manual and we have the participant manual. We developed the job aids to support the health workers in the delivery. We developed key messages, posters, fact sheets, jingles, and we even commenced awareness creation. Distinguished ladies and gentlemen, the feedback from the community is very encouraging. Some pregnant women testify to the fact that having used MMS, they were healthier when they compared to their experience in the previous pregnancy. We had a father that testified that the newborn, when the baby was delivered, the baby was clean and that the baby looked healthier. So we are having advocates. We together also developed the costed implementation plan for the introduction of MMS into pregnancy care. We trained over 120 national master trainers from the 36 states and the Federal Capital Territory. And as we speak, about 12 states have conducted the state-level training. Out of these 12 states, about 5 have trained up to the primary health care level. They have conducted the training for the frontline health workers. The delivery of MMS in Nigeria is a priority to the government of Nigeria. About 15 states have released different amounts into the Child Nutrition Fund. And one of the products, one of the nutrition commodities to be procured is multiple micronutrient supplements. All this is to ensure that as we are creating awareness, as we are getting positive findings from the implementation research, as the acceptability is being increased, we want to ensure that we do not have challenge with the supply.
The Senior Special Assistant to the President on Public Health in the Office of the Vice President, Dr. Uju Rochas Anguka, represented by the Technical Assistant for Nutrition, praised the implementation research project, highlighting its beneficial effect on women's nutritional status and the resulting health outcomes for children.
The implementation of MMS cannot be overstated. Its importance cannot be overstated, particularly considering its positive impact on the nutritional status of women and subsequent health outcomes for children. It is encouraging to note the substantive increase in adherence to MMS amongst the Nigerian population, an essential step in addressing the pervasive issue of maternal and child malnutrition. Over the past 2 to 3 years, this research has involved rigorous methodology and collaboration from various stakeholders, transcending simple service delivery to holistically enhancing women's confidence in their health choices. By coming together for this validation workshop, we are reinforcing our shared accountability in mitigating maternal mortality and unlocking the potential of our diverse population. I would like to acknowledge the Federal Ministry of Health, the National Primary Healthcare Development Agency, as well as Bauchi State Primary Healthcare Development Agency for their supportive framework to enabling this research. Our gratitude extends to the Country Director of Nutrition International and team, along with our partner organizations for their unwavering dedication and resilience in driving this initiative forward. It is through such collaborations that we can refine our strategies, strengthen partnerships, and implement solutions that will have a meaningful impact on our communities. As we navigate the discussions over the next 2 days, I hope we cultivate actionable strategies that will enhance MMS uptake in Nigeria and foster a unified approach to transforming health outcomes in our society.
And this is a project that when we started it, nobody gave it the opportunity. Nobody thought it would succeed the way. But we started from the scratch, taking the steps that the WHO came up with for any country that wants to initiate MMS. So when I spoke with Dr. Sita and his team, they decided to choose, we collectively chose Bauchi State for that. And it wasn't by mistake, which I've told the ED Bauchi, that why we chose Bauchi State is that we are sure of getting our data. And they did not disappoint us. The government of Bauchi State deserves a round of applause. Yes, because we have tried similar things somewhere. It never works. But right from the first time they got to know about this, they gave us all the support. And the federal government worked together with Bauchi State in selecting all the sites. We were carried along each of the projects. In fact, it's one of the best projects in the health sector. The federal government can beat their chest that they are part and parcel of it to the end.
The Senior Program Officer, Gates Foundation, Mr. Alem Hadera Abe, reaffirmed the Foundation's commitment to funding the successful implementation of MMS.
A pleasure and honor on behalf of the Gates Foundation to be here amongst you. All protocols observed, but I would like to really thank my sister, Madam Bako Emena, which is really for me, it was a good introduction into the health system. Through her sisterly approach, she's available anytime. When you call her, she's there. Her passion is infective. The energy, the enthusiasm she showed. My brother, Mr. John, have started it well, but she finished it very well. And it's something to start, it's another thing to finish. So finishing line is important. So I'm really here to congratulate my brother, Dr. Osita, and his team. We supported this initiative because NI has a track record for implementation research. Not only in Nigeria, Nigeria has advanced, but many other countries, including Pakistan and Ethiopia, we support NI to generate evidence. Evidence-based programming is key to the success of the implementation. We have successfully completed the first phase of evidence generation. We will discuss the results, but it's really amazing results, how MMS is really superior in terms of adherence. Mothers like it, but we need to support it through a community mobilization, active seeking of pregnant mothers, so that they use MMS not only in the facility-based routine system that ANC is an important element, but also linking it to community structures would be much more effective. So that linkage, that bridge has to happen. Our community health workers need to link to volunteers that are going house to house. That young pregnant woman is in her house, not in the facility most of the time. If I'm not mistaken, we have around 40% health-seeking behavior to ANC. It's not big, which means we can only look into 40 to 50%. Half of them are in their homes. So how do we make them come to the facility is important. So these results are coming at a time where global evidence is lacking. So you should be really clapping to all of you, because NI has managed to generate a clear evidence that mothers like multiple micronutrients because it has a good advantage over iron folate, not only in changing birth outcomes and anemia, which is a better outcome, but also in terms of acceptability. At the end of the day, if mothers don't like it, no matter what type of technology you introduce to mothers, it will not be adapted. So we have really a very transformative, especially the high level of anemia. 67% of women of reproductive age are anemic. So this has come at a high time where Nigeria and few other countries will globally lead on MMS rollout. So our emphasis now, moving forward to scaling up MMS.
At the close of the validation meeting, nutrition experts called for the integration of multiple micronutrient supplementation into routine health services, describing it as critical to expanding access and securing sustainable public funding.
There is a possibility of government being able to scale up MMS using local resources. And the local resources we see here is when government is able to apply domestic financing through the drug revolving fund scheme, through the health insurance schemes, and also through direct allocations to resource for nutrition. But
Since the coming of the MMS research and adherence research, we realized that we need to start a sustainability plan. And one of the sustainability plan that we think is very, very important is actually to have a budget provision and release for MMS, which we have already. And then we also explore other things that are already there. The support coming from the Federal Ministry of Health through the DLIs and locking value chain, where we have support that we can utilize the fund if we carry out certain activity.
Thank you very much. Sustainable financing is very key to optimizing the MMS rollout. And then what is very important, the opportunities that we must take advantage of is to ensure that the MMS is planned for in the national multi-sectoral plan of action for food and nutrition.
They stressed that securing lasting financing means making nutrition a government priority, complete with a dedicated budget line and mechanisms such as the drug revolving fund. Findings from the Bauchi study, which focus on improving adherence to maternal multiple micronutrient supplementation, show encouraging results. The intervention recorded significant improvements in maternal health and a reduction in anemia among pregnant women. Notably, over 80% of participating women completed the full MMS regimen, reflecting a marked improvement in adherence compared to previous supplementation approaches. And that's our package on Health 247 today. Join us next week for another insightful edition. Until then, eat well, stay healthy, and take care.